Fox 13's Dr. Joe is following the developments for us this morning. Dr. Joe, first question. He goes to the doctor the first time they release him. I'm curious to know if the doctors knew this man had been to Liberia, if he mentioned it at all, or did they ask?
Good morning. Yeah, we don't know the answers to that yet, but generally speaking, on that intake form that you fill out, your history form, they do ask about travel in emergency departments. So not sure where the disconnect was. And again, we were told he was given antibiotics, and the one thing that they did say is that sometimes the symptoms of Ebola are very nondescript. They're nonspecific, and they can resemble things that are common. So in this particular case, he was given antibiotics because they probably thought he had something that was not Ebola. And again, remember the symptoms are fever, there can be headache, muscle aches, diarrhea, vomiting. So again, things that can happen just in everyday life. So again, not sure why, but I guarantee you there will be an investigation on that.
Joette, I watched you yesterday. I was watching all of this play out, and the things that I heard yesterday, and that we should take some comfort in, I think, is it's an incubation period of what, 21 days. Apparently the man did not have symptoms when he was on that plane, so we are to assume no one on that plane was infected, yes?
Tom Frieden said there is zero risk to the travelers that may have been in the same plane with this particular gentleman. So they said that the temperature is taken before they leave the airport in Liberia. If they are positive, if they show any signs of anything, they're pulled out of the line, they're evaluated, not allowed to get on any plane until it's proven that they do not have Ebola. So that's what they say. So again, I do not think that they're going to go back and look at the manifest and contact the individuals on the plane. There is a number, though, on the CDC website for anyone who might be concerned. So I think that there might be an outlet for those individuals who might, have that fear. But once they become symptomatic, that's when things happen. That's when they can spread it to someone else. So, and we're talking about body fluids. So we're talking urine or feces or vomit or sweat or blood. And so, and I take a little bit of comfort in the fact that there was a Liberian traveler, this was way back when we first started hearing about this, who had gone to Nigeria. He was on his way to the U.S. and stopped. And to my knowledge, even though he was symptomatic on an airplane, I do not think he spread it to anyone on that plane. He did subsequently spread it to healthcare providers, and those are the ones that you really have to be concerned about. The paramedics who transported him, or anyone who may have been in contact with this particular man when he was, very symptomatic.
Let me ask you this as a follow-up, because now, I mean, it's a horrible disease, and we've been watching it from afar, and it's not that far away anymore. I have to ask you this: do we know when these people are allowed on planes in these West African countries, and these people are observing them? Do we know who these people who are doing the observing? How trained are they? Are they healthcare workers?
That's a good question. I do not think that they are healthcare workers. I think that they have been trained. And remember, CDC has been on the ground there for quite some time, and I know that they were involved in some of that process. So it's kind of that train the trainer type of scenario is likely what has occurred. So I would hope that they have adequate training, and hopefully no one is able to kind of slip through and not be screened.
Yeah.
I want to ask you one more question, because I know we're running out of time here, but I think it's important to mention. Let's talk about the risk to the rest of us. I think the one thing that the director of the CDC said yesterday that was comforting was, even if more people are infected here in the United States, the CDC will be quick to contain this. It won't be a widespread outbreak the way we've seen in Western Africa.
Yeah, and I think that that is true. And again, when we go back to that Nigerian traveler, there were about 19 secondary infections, is what Dr. Frieden said, and it was completely contained in Nigeria. And I got to think that we have a superior, I would think, healthcare system than Nigeria does, although Nigeria does a pretty darn good job. So yes, it could be contained, but it could spread to someone else in the interim. So it's that access to care that is critical. We cannot have anyone have any barriers to going in and asking for treatment, whether they be here illegally, whether they not have the ability to pay. We have to make sure that people know that they can walk into that emergency room and say, hey, look, I think I might have been exposed to Ebola. That is a critical piece of this. Right. And that, in addition to the tracing, the epidemiologists, the people going down and saying, who have you contacted, who have you had contact with, and then following those people, taking their temperature, making sure that they don't develop symptoms, and if they do, getting them into treatment immediately, that will stop that spread.
Good point. Very good point. Joette, thank you.